one. No. Yeah, so take it away. It's confusing. So I'll be discussing about whenever we are taking a case, a good screening followed by making the correct diagnosis, treating those patients who need treatment, and then, of course, regular follow up. All this journey, it's very important that we know how to do it and what would be the best way to approach. So, as we all have discussed ROP in this meeting and such a relevant topic, we have a session here. I think most important thing is that every time we have these testings, it has to be repeatable. It has to be ensuring that we have a timely treatment, which we take for the patients. And we're looking at what will be the things that we would be needing to do that. So, a practical lenses that we use in our everyday ROP screening are either a 20 diopter lens or a 28 diopter. 28 diopter is, you can say it takes the heavy weight, is the most regularly used lens. And as my colleague was talking about, that in certain cases where you want to have a deep dive into a particular lesion, always carry a 20 diopter lens with it. The correct positioning of the infant is also very important. Of course, the iCrop 3 is there. We just had so much good information. And then, of course, today we'll be talking about how we use the wide angle imaging and what would be the different pulse. So, always remember, consistency is what we are looking in our examinations, in our recordings, how we approach the patient, how we make our drawings, and how much repeatable these zones that we put in. And when we're looking at the extent, the presence or absence of plus disease or pre-plus disease, sometimes I've seen in a very good examination, if it is not followed by proper documentation, that can be counterproductive. Just a small miss in one examination of a certain feature, and then when you have 15 kids, 15 babies, and then you think, oh, was it there, the finding? And then you may have to go back and check. Or sometimes it can be difficult when you see your notes the next time. So very important, not only a good examination, but it should be followed by proper documentation. So, like in this slide, this is very important to enumerate that the 20 diopter has a high magnification and the field of view is smaller, but of course, it gives you a higher magnification, while 28, your viewing distance is less rather than a 20, but of course, you get a better view, of better, and especially when we're looking at the zoning, I think it's very important we become comfortable with a 28 diopter lens, because it's very critical that it has to be repeatable and our understanding that where which zone ends, and I think my colleague has already described so well. So, of course, we discussed already zone 1 is right about from the disc to fovea twice, that the center of it is always, remember, the optic disc. And then, of course, the 2 disc diameter further annulus, which has become very important after the publication of this study, that we want to see. We would like to, of course, know zone 2 and zone 3. That is, I think I'm not going much in detail, but of course, that's very important. So sometimes babies really small, and then sometimes they have other issues, and we cannot approach them. We cannot have a comfortable view. How we approach these babies, how well we can actually position ourselves, how well our, it's very critical to have an NICU nurse who is supportive and adaptive and can actually facilitate. And a good coordination between yourself and the neonatologist is also very important. So before starting, small things like asking which are the babies, if there are more than one babies who have sepsis, to take those babies in the end rather than in the beginning, or for that matter, when we are planning between the triplets, or sometimes there are twins and triplets, how well we are able to make sure that we do not confuse ourselves between. So it's always a good idea to not only examine, but preferably make the recordings of that particular baby just after the completion of the exam. And that goes a long way in making you comfortable, that you show that whatever readings you are having in front of you, they are consistent and they are reliable. So sometimes it's challenging, but doing an indirect ophthalmoscopy can be very difficult, especially if you want to see. And it's very important that we have a good speculum which is properly sized for that baby. If the speculum is not properly sized, the baby will be uncomfortable, you will be uncomfortable. I had chances in working in hospitals where they give extremely tough speculums, difficult to put in and difficult to take out, and that causes the saturation go crazy for the babies. And it's very important that we, even these small points, it's better to organize the visit well. So sometimes that may be a small thing like a speculum can make a big difference. Now depressors, you can have the steel depressors which are there, or I prefer sometimes to just use an irrigation vectis, small one, and it goes very handy, and you can have the irrigation at the same time. So you can just put it all together and you would not be needing anything else. And of course, sometimes, a comfortable environment for the baby is very important to decrease the chances of desaturation. So anti-fogging, interface gel, and warm lens, I have never tried, but I think I'm sure some of my colleagues they have, but I think that can be some things that can be tried. When we're looking at the baby, small things like giving a little sucrose in especially the when the neonatologist and the whole team, we make protocols. If there is a protocols based approach for dilatation of the pupil as well as for that, can be really helpful. So it's okay. Yeah. Sorry about the glitch. So prepare well and a good coordination with the team. And while doing the examination, sometimes the nurse will say, and you can also see the values, the baby goes into desaturation. So it's not a bad idea to have a sufficient time to just pause for a while, let the baby stabilize, and then continue the examination. So prepare, soothe, examine, and of course, that gives a good recovery. That's the way to go about. So examination position, now we even have sometimes speculums which are disposable. That's a very good. Some hospitals have, some don't have, but that can be something that can be used. And head stabilization is very important. If you have a nurse with you, preferably try to do it with a nurse rather than doing it alone. And of course, corneal hydration and your own positioning is very important. And then of course, based on your examination, making a correct zoning is also very important, because that is how you will make a decision whether to treat the baby or to wait and watch. So scleral depressors, they are very helpful, and I think that's very important to have a scleral depressor whenever we are talking about doing an ROP. I have seen some colleagues, they say, well, I have experience, I can go without, and I can. No, I don't believe it. Well, sometimes you can go up to a certain extent, but I don't think extreme peripheries you can be sure about the extent of the disease. And then of course, how to coordinate the lens tilt is important. And if there is any stress, you need to stop right at that moment. Because whatever you examine will, based on that, you will be following up. And of course, the staging will also depend upon how well you position your babies and how you go ahead with the. So now coming on to the second part, that are what are the wide angle viewing systems. And for the last at least 15 years, I have had a chance to work on the different generations of red cams, and this is one of the most reliable machine that I have used. No financial interest, but because of just wherever I worked, this is has been. I prefer to sit rather than stand when I'm doing it, because it gives me a little comfort to maneuver my leg, because it's very important not only the baby to be comfortable, but also the doctor has to be comfortable, especially there are a lot of babies, and you don't hurt your own back. Rolling the the wiring around your neck can be a good idea, but of course ensuring that the sterility, or if at least the cleanliness of the area is also very, very important, that has to be incorporated in our protocols. And now, of course, not only you can have these pictures taken by physicians, but also the nurses or trained staffs can do that, and then send you all the, you have a system of DICOM where all these images can be not only stored, but can go from one part of the world to the other, and that opens up a whole new chapter how well we can use these devices, in especially with AI and with the availability of resources, especially in outreach areas. There are definitely few important things that not only you can, with this instrument, you can have a clear look at the retina and make a clear documentation, but also you can do goniography. You can actually make sure that you can see the anterior chamber depth, the anterior segment, if there are anything, just coupling it with an extra some amount of gel, you can actually use this to focus even the anterior chamber and make sure that you have a complete idea. You can also do fluorescein angiography. Not all of the RedCams have that, but RedCam 3 has it, and this is very critical now to give us information how we proceed. And it's about 130 degree that we get with a single scan. There are other machines that I'm seeing that are available, which I have not used myself, which are available, and they do have almost the same specs of 130 degree, and this is one of the I found. I didn't have a privilege to use this machine, but yes. Another way of doing a wide field is where you do not have a RedCam, but a lot of practices, especially in Dubai, I would say that we have Optus available with our retina colleagues and in our own practice. So we can always use the Optus, which is also helpful. And the flying baby technique is the best. So where you can not only take nice photographs of very wide angle photographs of the retina, but also you can also do the angiography. And this is a paper which actually enumerates the importance of angiography, which is so important, that not only examining but doing the correct testing, and how important now it has become, especially when we are comparing the fluorescein abnormalities in the vascularized region and in the avascular region. And the avascular regions, if you are able to document them, that actually can change the way you see the progression of the disease. So I think that's pretty much what I feel I would like to cover. This is a study that has been there, that FFA, we can either give it sometimes orally, but it is always better that if you have a neonatologist, you can put protocols and you can use this concentration of 20% solution, and that can be also be a good option to take good pictures. And of course, the positioning and how we position the 130 degree, and then further how we can put 5 pictures together, was recently documented in this nice paper, Sundrop study. It's worth noting it. And by doing that, you can actually have about 144 to 150 degree of view. And with these consistent, it's very important whenever we are making a treatment decision. So it is always good to document this, not only for making sure that we are not wrong, but also making sure we are medical legally covered. Whenever we have pictures to back up our examinations, it actually can help us medical legally, because that's another issue sometimes, that if you do not have documentation, then it can be counterproductive. Thank you so much. Sorry, it just, can you open it, the second last? Yes, again, the second last slide. The one before this? Before this. Can you go further? You have a question? Okay, okay. Can you please? How you can actually this one? These ones. So here we are, if you want me to go a little detail, so what is happening is that between these pictures, if you see the leakage shunts and all these lesions that you see, what they found that the ones which are at the junction between the vascular and the avascular area, peripheral, are more important than what you see within the vascularized area. So when they compared the two, they found that the importance, especially when we are looking at predicting where this child will go in the next few days, they found that the ones which are having these abnormalities right at the periphery, that was more meaningful, and those kids were more likely to get into issues rather than the ones where those same kind of abnormalities were within the vascular area, let's say the posterior pole. Yeah. Yeah, but yeah. 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 So the question is that, do we need to buy these machines which have FFA? That's the question. I don't know if somebody can answer that. Yeah. Thank you. Thank you. So, yes.